afternoon, everybody. This is Connie Burke at OASAS for our monthly regional abatement call regarding the opioid settlement fund. I'm on the road today, so I'm joining from the car, and I'm going to rely on Lucia to help facilitate, and just a couple of items on the agenda for today. We are joined by other staff, including Deb Davis from the Division of Fiscal Administration, some of her team, as well as Greg Meyer from the Council's office. And in terms of agenda items, I think I'll let Lucia introduce the first topic, which I think is a to be continued from our last time together.
So I know Kristen sent out the updated FAQ, which had some additional questions about your documentation procedures for accounting and sort of the state finance reference in terms of, do we sort of track the money straight from a settlement down through to you and your dollars in your account. So Kristen circulated that document. I hope that clears things up for folks. We do have Debbie and Greg on the call with us in the event that you had follow-up to that FAQ. So I'll sit tight and see if we have any raised hands, or you can take yourself off mute if you wanted to follow up. Not seeing any hands.
So did folks have a chance to read that document? Or are there any outstanding questions on the tracking? I guess we solved all the issues with the documentation we put out.
Should additional questions come up, you can always send them to the project management inbox. So the FAQ, yeah, sorry.
I'm sorry, Steve. I'm going to take a risk and tell you, I don't believe I got that. So I would love to, maybe if you could send it again.
Yep, we can send it again, and it is going to be posted. It's posted on the regional abatement website.
Great. I promise I'll read it and I'll have a question.
Okay. You don't have to promise to have a question, Dr. D, but we'll allow it. We'll allow it. So go ahead, Connie.
So when will the updated FAQ be posted?
Kristen, oh, sorry.
It's already posted. It was posted a few days ago, right on the website. I can put that
so somebody could.
Yeah, we'll throw that in the chat.
Yep. Perfect. Okay. So maybe once folks have a chance to read that, then they may have questions. It looked like in the chat there were others who hadn't received the document yet. So, it could be a to be continued for next time once you guys review the document. But certainly if you do have any questions about how to track the dollars, please don't hesitate to reach out to the project management mailbox, and we will we'll circle up with Council's office and with Fiscal Administration to be able to provide you with a response. Okay, and it looks like a lot of folks didn't receive it, so we will have to double check on how that was sent. Know that it would have come from the OSF project management mailbox and that address. So hopefully that address isn't flagged as spam by your mailbox administrator, so that information is getting through to you. But we will check our process as well, just to be sure. Okay, so then, actually I realized we have 3 items on the agenda. So the next item, we did want to make you aware of the fact that we will be issuing the award letters for the 2024 appropriations next week. And so we are following the same process as we did for the 2023 appropriations. You will be notified. There'll be a letter attached to an email that you will receive. It will indicate the amount that you are being awarded. And for LGUs that are serving as a pass-through for the other litigating entities, not including the 5 large cities, the amount that will go to each of those will be included in the letter as well. So this applies to most of you in that I think we do have maybe 2 outstanding providers or outstanding recipients who have not yet either submitted their planned use of funds or have not submitted their report. So just as a reminder, we were using the reporting, the planned use of funds and the reporting as our kind of contractual agreement and our way of saying that you are in receipt of funds and that you are following the rules as to what is allowable use of funds. For example, following what's stated in the settlement agreements, and very importantly, no supplantation. I think first and foremost, no supplantation. So you'll be getting those letters next week. We anticipate that payments will be made in January. So we wanted to be sure that you were aware of that. Again, always wanting to maintain communication with you. Also for folks to be aware that the payments unit is, needless to say, managing a wealth, no pun intended, of payments in terms of our multiple funding streams that we have active right now. So it looks like January will be when payments will go out. We do want to get that letter to you, however, next week so that you have an idea what the amount is. We can also give you a heads up when payments start rolling in January. We didn't want for folks to get the letter and then say, hey, where's my money? So we wanted to make sure that you had a heads up that the money would be coming through in January. Debbie, did you want to add anything to that?
No, it's just our way of saying Happy New Year. No. So, but I think that flow is very similar to last time. Outside of those who receive their first quarter advances, then the next thing that is going to be processed will be these payments, and that's at the start of the new year. So that'll be exciting. We're going to move on those $2024.
So that's super exciting. And I like that, Debbie. It's a nice New Year's gift. So the letter is a nice Thanksgiving gift, and then you get the money, the dollar amount, the actual cash for the new year. Lovely. Lovely.
What about Christmas?
We are, Debbie and I are baking cookies, and we're sending them out to all of you. Oh, dear. Which means we better start baking, Debbie. That's a lot of cookies. Just saying.
Very true.
Okay. And so I'm having items added to the agenda as we go on here. I understand the first focus group occurred this week, and I heard that it went very well. So thank you to folks who were able to participate in that. We do very much want to hear from everyone in terms of how this process is unfolding, how, especially for the counties, how you are thinking through the use of funds, how that process is moving for you. So thank you for that. Lou, did you want to add anything to that?
No, that you covered it. So we are looking to schedule and complete those through December, so we can give you an idea of what the reporting requirements will look like moving forward. But it really was, it was a great conversation. It's not, sorry, I have a very vigilant antler. It's meant for us, you know, we learned a lot, I guess I should say. It's really for us to learn about what's been going on, and sort of your process. So it was super helpful.
All right, great. And let's see.
Hey, Connie, there's
So
a
I-
question
Mhm.
in the chat that I think could be good to answer at this time. Will the funding be automatically dispersed in January, or is a planned use of funds form required? If the latter is true, when is that due? And so I know the answer, which is to be eligible for receiving the fiscal year 24 dollars, you must have submitted a report, right? And so if you've submitted a report, you're going to get, you know, your award letter, and you're then going to get your funds. Lucia, for those that did not fill out a form, a report, are you going to still give them an award letter, but note in the award letter that they can't receive their funds until you receive the
No.
report?
So it's a very small handful of people who fall into this category. So we're following up with them individually. So no, they're not going to receive their award letter until we get the reporting from them and they know who they are. Hoping that it will, you know who you are, and we are, you know, we hope, because we do have this month that is a little bit of a gift in here from when we're trying to do the award letters to when the payments will go, that we can get everybody to the point of having their award letter and getting their payment in January. So yes, Suzanne is asking, was the report, the survey? Yeah, so the what you submitted to us in August/September, around that time period, that's what we're going on in terms of, we heard back from you. We understand that you understand what you're doing with your dollar, and so you're going to get your $24. So this like startup period, as we've talked about before, is a little wonky in terms of aligning calendars. And so next year, we're really going to get on that annual cycle for reporting.
Exactly. Okay, so, and two, we didn't want to make this overly burdensome by having you tell us each year how you plan to use the funds and then also have to report out. So we're trying to make this as efficient and easy as possible for folks. Because there's not a lot of that, right? Trying to figure out how to spend all this money and what to do with it. So the other thing that I wanted to check in with folks on has to do with planned use of funds and actual use of funds with regard to dollars that are going towards housing. So I was hoping that we could just take a minute. For those of you who are using regional abatement dollars to address housing issues in your county, if you wouldn't mind talking about your process and what you're considering using the dollars for. Part of the reason why I'm asking the question is because we are in the process of developing a certification for recovery housing in particular. And as we know, recovery housing is not part of our system of care. It's not part of our continuum. Our Housing Bureau is working hard to learn and know as much as they can about programs that do exist that fall under that category. And so interested to hear from counties if you are using any of your regional abatement dollars to support that type of programming, of recovery housing, or other housing options that you're considering.
Yeah, Catherine, go ahead. Oh.
Good afternoon. This is Kathy Coons from Rensselaer County. We put out an RFP asking for application to manage some of the monies for rental assistance or subsidy for those who graduate from OASAS licensed housing, are reentering the workforce, and can't afford, based on what they are receiving from DSS, or reentering the workforce and not having a strong enough salary, to be able to afford an apartment in a community that has more protective factors to support recovery. So we're trying to enhance the back door, if you will, out of OASAS licensed housing. And we're looking at assisting someone for a period of the first year that they're living in the community in recovery, and that we would then evaluate at the end of the 12-month time period. But the applicant also needed to be reporting to us on outcome measures that we've articulated, and be working with an interagency team led by the LGU, who will review all applicants for the program.
So just to be clear, Kathy, so, oh dear, I'm echoing. So this would be basically a 12-month housing for individuals?
I don't know that if you call it housing, it's a rental subsidy, and they
Okay.
would be finding their own apartments.
Okay, that helps. Okay, thank you. I was just, as you were talking, I was thinking about our transitional safety units, and wanting to understand how yours operated, versus that model that we're implementing.
I'm not certain what the difference is, to be honest with you.
So with the transitional safety units, we actually are providing funding to our housing providers so that they can assume rental space, I guess apartments, and then have individuals who are in transition stay in those apartments for a short period of time until they're able to secure more permanent housing.
I see. Now, we wouldn't want the agency taking on the landlord role. We want them to be in an apartment that would be permanent for them.
Understood. So that they would then be able to assume the lease.
Correct. Well, they would always assume the lease. The lease would always be in their name.
Okay. Okay, great. Thank you. Others?
I just wanted to say, Connie, there was a question in the chat about how often is reporting required. So, which is moving forward now going to be annually in March for the previous calendar year.
Great. Any other folks using regional abatement dollars to support housing efforts? No. Okay. Do folks have any other questions just with regard to the process, regional abatement? Any outstanding questions or issues? Oh, so Anne asked if anyone's using the dollars for transportation. Anyone?
This is Ann. I'm asking because we're trying to get a program off the ground where we are providing rides for our participants of our drug court to and from their treatment and to court and to self-help. And we're starting from scratch. So I didn't know if anyone else was doing something similar. Maybe we could share ideas.
So Anne, although I don't see others raising their hands or unmuting themselves, OASAS is utilizing funding to support transportation in counties. And there are, I'm sure that we can put you in touch with providers who are delivering that service if you are looking just to get input from others and looking for some suggestions or just hearing how people are managing that.
Yeah, it's really we've already got a list of vendors that we're trying to work with. We just are trying to figure out how we are going to pay the vendors and keep track for reporting as far as whether the rides were utilized, and how do we do that given privacy concerns of the participants as well.
I see Sarah's raising her hand. She may have an answer for you.
Hi, this is Sarah Barenko from Montgomery County. So one thing that we are doing is we are working with our CDTA bus line to purchase monthly bus passes for drug court participants. And we decided to purchase monthly tickets because it's more cost effective, but the participants can also use those bus passes to get to non-clinical services. So no offense to OASAS and all this money, but it's great that we're allowed to help people get to clinic services, treatment, all of that. But if we're trying to really help people reorient into life, they need to get to the grocery store, they need to get to the bank, they need to get to their kids' school events, they need to really be integrated in life. And harm reduction is really about teaching people how to live in the community where they are. And if we're only pigeonholing them into treatment-based services or medical-based services, then we are doing them no good by only allowing them to utilize transportation for those areas of their life, because that's not their whole life.
Yes, Sarah, that's a really good point. And I do believe with our non-medical transportation effort, it does expand beyond. So recognizing the fact that, you know, as a person, you have multiple needs with regard to transportation and support and assistance. So we agree with your approach.
Okay, can I follow up on that? I also agree with that, but I was thinking that it was very specific that we had to use these dollars specifically for treatment stuff. But does there have to be an opioid component to the person who's receiving a bus pass or a voucher for transportation? Because so I'm the court administrator of Amherst Town Court, and I'm going to be taking the bench as judge in January. So I know from practicing law, like there are people who have opioid use as, you know, a very small part of their addiction. And they're really, we don't have that many people who that's their main addiction is opiates. We have a lot of people who are using alcohol and crack cocaine and other substances, but may occasionally use opiates. So we're struggling with this determining which participants of our drug court we can offer this transportation to. So does there have to be opiates involved, and does that have to be the primary diagnosis?
So Anne, from my perspective, no, it does not. I appreciate the question. I do know that for some of our funding, in particular the State Opioid Response Grant that we received from SAMHSA, it is necessary for individuals to have opioid use as a primary, secondary, or tertiary substance. That person could have an active OUD, or it could be, you know, past use, which would render them eligible for the services funded under SOAR. So know that the Opioid Settlement Fund does not, these are considered state dollars, so they're not subject to that same criteria.
Connie,
The criteria, though, is that it has to be for abatement purposes, right? So, you know, so you know, the measurement stick, if you would, is, you know, it's kind of a fine line, but, right, and you have to make that judgment. Is providing a ride for this person preventing, you know, or addressing the opioid epidemic?
you know, Deb and Connie, this is Steve in Albany. If I could just jump in. I mean, this is a great question, and in some ways it's at the heart of what we're doing at the settlement board. You know, prevention is part of what we need to spend some of this money on. And prevention is, in my mind, preventing people from, in many ways, even beginning opiate. This money, abatement, it can be broadly interpreted, it seems to me. We want to stop people using who are using. We want to prevent people who aren't yet using from using. And I think that you could make a case, although I think you'll have to justify it, that you don't have to be giving money to people who are using opiates to adequately, spend this money and meet the criteria. I think it's much broader than that.
No, I agree. I just think it's the measurement stick is just, is this something that would prevent it? Is this something that would address the epidemic? And I think it is broad. It is broad.
Yeah.
And that's the question you ask yourself. And if you're meeting it, you're documenting it, and that is perfect,
Right. We agree.
Greg will let us know.
Yeah, I agree. And actually, I know Dr. Giordano, I've talked about this a lot, but 2518 is broad in many ways, and it talks a lot about SUD, not OUD, right? And you still want, as Deb alluded to, the OUD component, but I think it can be broadly construed in that way.
And this is why I'm not an attorney.
Thank
And
you
I'm glad
guys. That
we
was
have
very,
Greg.
very helpful.
Yeah. Other questions folks have? All right. Lucia, anything in the chat, or do you see any hands that I'm missing?
No, nothing.
I was just
Hold on.
gonna,
Oh, sorry. Is it possible to get a cheat sheet that has the name of each fund and the requirements for spending? So Connie, it sounds like sort of what we did at our little lunch and learn. You use the SOAR acronym, so but this is coming from City of Yonkers, so
Yeah, let's defer to Debbie on that one.
mhm.
No? I was
no,
looking at you,
no,
Debbie.
I would just say that this call is on the use of opioid settlement
OASAS.
fund dollars.
Mhm.
So that really is the main thing that we would be speaking about. I think that the question that was asked just lent itself to talking about a comparison of different funds, but normally we wouldn't be talking about
Right.
other funds. So I don't know. I mean, there's an unlimited amount. No, I guess there is a limited amount of funds, but we could go on all day about funds, but it wouldn't be an efficient use of time for this call. So hopefully that makes sense to you. I understand why you might be asking, just because we had done a reference about a different funding source, but in general, we're really talking about the use of opioid settlement fund for this purpose.
I know we had a conversation, the 5 cities was our focus group. So again, the Attorney General's dollars came up as part of opioid settlement fund dollars. So, but as Susan put in the chat as well, the Schedule C, and Greg, correct me if I'm wrong, applies to both. Sorry.
Sorry, say that again.
AG is, so, okay, so Suzanne.
Hey, I'm like, Schedule C is capital projects
Oh,
for
no,
us.
okay. No. Suzanne.
I know what you meant, Susan. We got it
Right,
now.
so for the
Schedule C.
litigation, we had 2 schedules provided to us. One was Schedule C, which we use to frame our regional abatement dollars to the LGU. And then for our county, for the AG funds, we utilize Schedule A under the litigation framework.
I think our perspective is we're kind of trying not to opine on the AG's funds, that's up to them
right.
to.
But in terms of, my office, I was fortunate to have to manage both the AG and the LGU abatement. So that's how we framed it out for anybody who requested funding from either of those pots of money. And one county.
All right. Other comments, questions, concerns, good Thanksgiving recipes that folks want to share? All right, going once, going twice. I appreciate our efficiency and the fact that people keep coming back to these calls every month.
Can you direct us where we can find the Schedule A and the Schedule C? I know is the Schedule C the use of funds, and then Schedule A for AG. Where can I find that?
So I believe both documents are included in actually the first opioid, the first report that was issued by the board last year in the appendices. Go ahead, Lucia, if you have a better answer, or Greg.
I'm going to work to pull up what you just mentioned, Connie, and put it in the chat. But Greg,
Okay.
do you have?
I think they're on the AG's website.
Yeah, I'm trying to pull it up now myself. If I can pull it up quick, I'll post it in the chat.
So some of us came late to this, and so we're playing catch up. So we're trying to get all the information, so we're at our best. So that's why I wanted a cheat sheet or something. I know you sent us back to look at 12 hours of video. But if it was, just for us, if you can provide the AG's email address or the AG's website, it would be very helpful as well. Thank you.
So thank you, Lucia. Lou did post the PDF for the allowable use of funds, approved uses. Greg, are you still searching? Or did you want to add anything?
No, I'm just going to put my email address in here. If there's any follow-up questions from the folks in Yonkers or elsewhere, feel free to email me.
Yeah, and for the folks in Yonkers, when you say you were late, I don't know if that meant you were late to the call or you're late to this entire good time that we've been having with opioid settlement over the last year. So certainly, if you do have questions, thank you to Greg Meyer, who is in the OASAS Council's office and is very well read in on OSF. If you have questions pertaining to the process for receiving the regional abatement dollars, you can certainly feel free to reach out to the Opioid Settlement Fund Project Management mailbox. And if we need to jump on a call with you to get you up to speed, we can do that. And I'm a little bit offended that you don't want to listen to our 12 hours of previous meetings, because they're a good time. And Debbie and I sometimes just listen to them over again because we want to relive all the moments that happened in 2023 on opioid settlement. Oh dear. All right, any other questions? Anything else coming up in the chat, Lucia?
No, I just put the AG page that I'm most familiar with in there.
Awesome. Great. Okay, folks. So if there's nothing else, we're always here if you need us. Again, the Opioid Settlement Fund Project Management mailbox, and know that you are also supported by the team, Debbie Davis's team in fiscal. And we'll talk to you next month, I think. I'm not sure where our call falls in the weeks leading up to, the holidays later in December. But happy Thanksgiving. You're going to get your award letters next week. Oh, that's your Thanksgiving. Steve was looking for a Christmas gift. I'll have to think about that. But something other than
It's okay.
I didn't see a lot of woohoo and thumbs up on the cookie idea. So I guess
I'll stretch it to Christmas. Don't worry about it.
Well, the December meeting is your Christmas gift, I think.
Thank you very
There
much.
you go. Woo-woo. So thanks, everybody. Appreciate all the work that you're doing. Please enjoy the holidays, and we'll talk to you soon. Take care.
Thanks a lot. Bye.
All right. Bye-bye.